Hello and welcome to Health Matters on Breakfast Show, Coal City 929 FM, Radio Nigeria, Enugu. Your trusted space for life-saving conversations that impact us all. I am your host, Ekene Odigwe. And today we are looking into a critical public health issue as we mark World Hepatitis Day 2025. This year's global theme is hepatitis. Let's break it down. A call to action to demystify the disease, confront the stigma, and push for real solutions, especially right here in Nigeria. To help us unpack this, we have Dr. Ejiofor Mamah, the first Vice Chairman, Association of Professional Bodies of Nigeria, APBN, Enugu State Chapter, and the immediate past chairman of Association of Medical Laboratory Scientists of Nigeria, Enugu State Branch. Also, Assistant Director, Medical Laboratory Service, UNTH, Ituku, Ozalla, Enugu. You're welcome.
Thank you so much for having me.
Let's start with the basics, Dr. Mamah. For many of our listeners, the word hepatitis is familiar, but the details are still fuzzy. So let's begin by breaking it down. What exactly is hepatitis and what does it do to the body?
Thank you so much, my moderator. It's fuzzy because people are not quite aware of what hepatitis is. So coming to your question about hepatitis, when you hear the word hepatitis, it means the inflammation of the liver. When I say inflammation, when you have heard the word titis in medicine, it always means inflammation of anything. But this time around, hepa stands for liver, and then the titis then means inflammation. In this case, now we are talking about the inflammation of the liver cells. And two things can cause this. It can be grouped into two: the viral hepatitis and also the non-viral hepatitis. When you come to viral hepatitis, some viral infections that can cause the inflammation of the liver cells, and it has been attributed to hepatitis A, hepatitis B, hepatitis C, hepatitis D, and then the hepatitis E, 5 of them. Then when it now comes to non-viral hepatitis, it could be caused by autoimmune disease. It can be as a result of alcohol. It can be as a result of toxin, drugs. It can be as a result of metabolic disorder. And it can be as a result of a low supply of blood to the liver, which we call ischemic liver disease. So those are the ones that can cause inflammation of the liver cells apart from the viral infections.
We hear about different types, A, B, C. Can you explain the differences between them, especially hepatitis B and C, which are the most common in Nigeria? And what makes hepatitis B and C particularly dangerous compared to the others?
Yes, it's good we talk about hepatitis B and C. And in course of our discussion on the mode of transmission, you know why it is very, very important for us to have these two viral infections in mind. Hepatitis B and C has a very high prevalent rates across the globe. Globally, not less than 300 million, as at last research in 2022. It was 304 million people are infected with hepatitis B and C, of which, unfortunately, about 1.5 million people always lose their life annually. And as we are talking now on daily basis, not less than 1,500 people are being infected of this hepatitis B or C. So that is why people are talking much about hepatitis B and C, because it's very deadly, and if not managed properly, apart from damaging the cells in the liver, it can lead to liver cirrhosis, liver cancer, and then unfortunately death. And very, very important, we also know that the major route of transmission of this B and C are always the same.
Now, let's bring it home. In Nigeria today, millions are living with hepatitis B or C, and many don't even know it. Why is hepatitis such a major but often overlooked public health issue in Nigeria?
Okay, when we bring it down to Nigeria has a population of over 200 million people, as the report of 2006 census has it. For now, we are heading up to 250 million by estimation. And the current prevalence of hepatitis B in the country is about 1.9. So with this now, you have find that the last survey, that was in same 2022, stated that Nigeria has over 1.9 million people living with hepatitis B and C as well. So it is very, very important for us to know that hepatitis is with us. It is not only the Western world that have it. It is also present with us, even down in Enugu State here. But when we now discuss about the geographical spread of hepatitis, it is higher in Northwest and very low in Southeast, with Enugu State having the prevalence of 2.5%, according to a local research here. So with that now, we should know it's within us, and we should be very careful on how we treat issues pertaining to hepatitis. And that is why the theme for this year, Let Us Break It Down, is very, very apt.
Some common questions we hear. Can I get hepatitis from sharing a spoon or hugging someone? What about barber shops, pedicure tools, or visiting traditional practitioners? Are they hidden everyday risks Nigerians might be exposed to without knowing it?
It is also good for us to briefly describe the mode of transmission of hepatitis B and all the hepatitis B from A to E. So when it comes to hepatitis A and E, they have the same route of transmission, the same mode of transmission. It's always gotten from contaminated food, contaminated water, because it's present in the feces. That is why we say it is a fecal oral. And personal hygiene also, people who do not wash their hands thoroughly can get infected. And people who have some intimacy with people in terms of sex, because people who undergo oral anal sex can get hepatitis A and E. But the good news about hepatitis A is that it has vaccine. It can be vaccinated. And hepatitis E, for now, we don't have vaccines for it. And the other good news about hepatitis A and E is that they can only be formed in an acute stage. That means it doesn't always lead to some dangerous situations, such as liver cirrhosis, liver damaging, and then forming cancer or forming fibrous state of the liver. Sometimes some people who are well fed, who have high immunity, when they contact this virus, it can easily be treated by oneself. It doesn't always lead to chronic stage. And you might even contract it and then heal yourself, cure yourself of it without you noticing, because it takes a very long time for it to start manifesting. So, and E also the same. But people who have low immune system it can lead to a very dangerous situation. So hepatitis B, C, and D, in other hand, it's always good for us to lay emphasis on B and C because they have the same route of transmission, and D cannot exist without B. It's always for it to start manifesting, for it to start causing danger in human or the host or the victim. There must be presence of hepatitis B. Hepatitis B can be transmitted through sexual intercourse because it's present in the semen, it's present in the vaginal fluid, and is also present in blood and mother bodily fluid. So people who undergo surgery, maybe tissue transplants, one can get it from there. So that is the means of transmission. And people who who share sharp objects such as needle, such as scissors, even down to the use of sharing tooth brush, as well as nail cutter, or anything that can have contact with the bodily fluid and is from the person that is infected, one can get it from there. So they have the same route of transmission. Hepatitis D also can be transmitted through sexual intercourse and other, even down to blood transfusion. But it is not infectious until it sees hepatitis B. And the main reason is because it doesn't have its own shell or envelope, as we want us to say scientifically. So, and unless that envelope is there, it cannot cause a disease condition. It will only be there until it has the opportunity of using the envelope of hepatitis B, and because without that, you will not be able to cause disease condition.
We often hear that hepatitis is a silent killer. What does that really mean? Are there symptoms people should look out for, or is it usually invisible until it is too late?
Yes, many don't know they have hepatitis viral infection. It's only when it has got to a very end stage of liver damage that people notice it. By then, people have started presenting the symptom. Because the liver is the largest gland in the body, it endures a lot. And it has a lot of cells, billions of it. Before it could damage all the cells, all the lobules, you find out that it will take a very long time. So if someone is infected, depending on the immune system, it might even take 10, 15 years, even down to 20 years before it starts manifesting. So people do not know. For every 10 person that tested positive, 9 of them do not know that they have viral hepatitis. So people do not know because they are waiting for the symptoms. And once the symptoms start manifesting, it is always at the end stage and it's always irreversible. So not that it's not there, but it is because people do not know. People are not aware. People, even if are aware, they take it lightly, and that is the bane of this viral hepatitis infection. Yes, symptom. Viral hepatitis generally has symptoms, but just as I said earlier, liver being the largest gland in the body can endure a lot of attacks. And because it's endowed with a lot of cells, the hepatocytes, it takes a very long time before the liver can get down. And liver has a system of even healing itself in any damage. Before any inflammation could reach the cirrhosis stage and cancer, you have taken years, as I said. But be that as it may, when it gets to the advanced stage, because viral hepatitis is always asymptomatic. When I say asymptomatic, it doesn't always present symptom at the nasal stage. But the common symptom which everybody knows is yellowness of the eye and the skin, because that is why in Igbo we call it Igbo chanaya. Once the eyes start turning red, that stage is hardly reversible, more especially if the cause is hepatitis B or C. And also in advanced stage, it can lead to weakness of the body. It presents weakness of the body. It presents nausea. It presents vomiting. It also presents the common symptom also is pale stool. Instead of normal brownish color of stool, you find out that the stool will be very pale, just like a clay color, because the bile is not well secreted, because functions of the liver, it produces bile for the metabolism of the food we take, and also detoxify drug. Because it doesn't do its work, you see that the system will not be properly utilizing whatever we are eating as a nutrient, and it can also lead to extra hepatic complications, getting to kidney diseases, where the extremities will be swollen, the leg will be swollen, even abdominal blood. You see the stomach protruding, that is in advanced stage. So generally weakness of body, abdominal pain, nausea, vomiting, sometimes fever. Finally, it can cause what we call liver cancer. And by then, the fibrous nature of the liver will be compromised, and it will not be able to metabolize the food we take. It will not be able to detoxify the drugs and toxins we take, and also it will not be able to do its normal functions, and in the end, the whole body system will be compromised.
One of the most confusing aspects for the public is how hepatitis is actually spread. There are a lot of myths out there. Can you break down the real ways hepatitis B and C are transmitted in Nigeria?
Yes, not only myths, there are a lot of misinformation. There are a lot of stigma in the society. So people do not even care much about that. Unfortunately, people are more afraid of HIV than hepatitis, without knowing that hepatitis is even deadlier than HIV. So, and also the awareness is very low. It's very low because after 28th day of July, people always go and relax to the next circle of World Hepatitis Day. The campaign is supposed to be almost on daily basis, but especially our people in the rural area where this hygiene we are talking about is very, very low, and also where the spread is very, very high. So having enumerated the mode of transmission, people should try as much as it can to practice hygiene and feed very well. Because when you have adequate diet, when you feed very well, even if you're infected with hepatitis A or E, your immune system will be able to battle it and then quench it before it could lead to disease condition. And if we are able to practice hygiene, we'll not be able to transmit it to the next person in terms of handshake or sharing anything in common, because there's a controversy that is also present in the sweat, but that one has not been confirmed scientifically. So it is good for us to spread the news but not the virus.
And some common questions we hear: can I get hepatitis from sharing a spoon or hugging someone? What about using barbershops, pedicure tours, or visiting traditional practitioners? So, Dr. Mamah, what are the hidden everyday risks Nigerians might be exposed to without knowing it?
No, viral hepatitis cannot be gotten through hugging and sharing cutlery. But there's also a hypothesis of getting it from sharing the same cloth. But there's a controversy surrounding that. So a lot of researches are going on that to confirm if one can get it. But there's every tendency that if one has a very high viral load, he could transmit it through sharing clothes. So that is why it's always advisable for us to not to share clothes, especially the underwears where there are openings in the system.
Well, if you're just joining us, we are talking about World Hepatitis Day 2025. This year's global theme is hepatitis. Let's break it down. Our guest is Dr. Ejiofor Mamah, the first Vice Chairman, Association of Professional Bodies of Nigeria, APBN, Enugu State Chapter, and the immediate past Chairman of Association of Medical Laboratory Scientists of Nigeria, Enugu State Branch. Also, Assistant Director, Medical Laboratory Service, UNTH, Ituku, Ozalla, Enugu. Now, Dr. Mamah, one of the most powerful tools in stopping hepatitis is knowledge. Knowing your status, getting vaccinated, and starting treatment early if needed. So, where can Nigerians get tested for hepatitis? Is it affordable?
Nigerians can get tested through a certified medical laboratory scientist practicing in, be it a government hospital or in private hospital and private laboratories as well. So one can get tested through laboratory services. We can't get it by speculation. Not all fever is a hepatitis cause. So the only way is through diagnosis. And laboratory services are rendering this for people in primary health centers, in tertiary and even secondary health centers, down to private. It's readily available. All those 5 viral infections I earlier enumerated. Yes, there are vaccines for hepatitis A and B, and is also available in our health centers. And in 2004, it was mandatory for any child born in any hospital to get vaccinated within 24 hours. And our primary health centers, our delivering homes, hospitals have been doing this. And that is why it is good for us to also extend this to traditional birth attendants. Those areas are where we have to beam our searchlights so that any child born should get vaccinated within 24 hours. And also adults who were not born before 2004, who have not got vaccines, should also get vaccinated. So the vaccines are really available. Come to testing, as you earlier asked. Diagnosis, testing is the key in the fight against transmission and treatment of this viral hepatitis we are talking about today.
Now, for someone who tests positive, what's next for them? Is treatment for hepatitis B or C accessible, or is it something an average Nigerian can afford?
If one tests positive, all hope is not lost. First of all, we have what we call the serological screening, where the blood samples will be collected and then screened for hepatitis B, C, A, D, as well as E antibodies. And if it tests positive, we have to go further to run what we call the hepatitis B panel, if it is hepatitis B. Here, we're also looking for the core antibodies and hepatitis B envelope antibodies. So if they are present, that means it has got to a chronic stage and there is need for one to commence treatment. And besides that, there is also need for one to test what we call the viral load. That one is a more advanced test, though all these testing techniques are available in Enugu here. But it takes advanced laboratory services to carry out the viral load, and it's very expensive. And that is why we are advocating for a subsidy. The government has to come in and incorporate this hepatitis into the HIV scheme so that people who test positive can commence treatment immediately, regardless the viral load. And people should also endeavor to take the vaccine, because if we have at least 80% members of the public who get vaccinated, it gives what we call herd immunity. So for people who are having vaccine hesitancy, those 85% can cover the remaining 15%. And with this now, we'll be able to eradicate hepatitis B by year 2030, which is just less than 5 years from now. So if one tests positive, is not the end of life. And there are researches going on now, and that is why we're encouraging the government to encourage research.
Beyond the medical facts, there is another challenge: stigma. We've seen people lose jobs, relationships, or even community support simply because they tested positive for hepatitis. Why is there so much fear and misunderstanding around hepatitis in Nigeria?
This issue of stigma is very, very important. We break it down. We have to break it down. We have to break this barrier, because the stigma from faith-based organization, from families, if you see somebody that tested positive, before you know it, people will be avoiding such a person, eating with the person, or even hugging because such a person has a hepatitis. That should not occur at all. You should not give space for that, because it's discrimination.
In your experience, how does this stigma affect people's willingness to get tested or even talk about it?
If somebody finds out that someone tested positive and is being avoided in the society, is losing his or her job, and even lost the relationship with somebody is so much love, any other person that tests positive would like to hide it and will not even be able to come out openly to say he has it. And there is need for us to come out in public and then announce our status, people who have it and who are on treatment. And they can only do this if there is hope. And the only way you can know there is hope is for you to be aware that apart from the vaccine, even if someone gets hepatitis today, among all these hepatitis we are talking about, they are treatable. All of them are treatable, but it's only one that we cannot say we cure, which is hepatitis B. All of them are curable and they are all treatable. Hepatitis B is treatable but not curable. But other ones are not only treatable, they are curable. And the one that is not curable has vaccine. And once you take your vaccine, you are protected already. And the vaccine is readily available in our primary health centers. And Enugu State Primary Health Development Agency, we're advocating for them to get down to the 260 wards across the 17 local government in the state. Make sure it's available, and then make sure there's awareness. People should get to know their status. And if we know our status, it will go a long way in reducing the spread of this viral hepatitis, more especially hepatitis B.
And what role can families, faith leaders, schools play in changing that narrative?
So thank you about that. It's very, very important. We have to state it. The family, the community leaders, and even traditional rural religious-based organization should come together, demystify this mystery. All this myth surrounding hepatitis has to stop. We have to break it down. Thank you.
What is the Nigerian government doing right now to tackle hepatitis? Is there a national plan that is being implemented?
When it comes to the question of what the Nigerian government is doing about this viral hepatitis, I think I have to, at this point, commend the First Lady of the Federal Republic of Nigeria, who has already incorporated this viral hepatitis treatment and testing, the diagnosis, the treatment, and even the prevention scheme across the 36 states of the Federation. The last time she visited Enugu State, in collaboration with the wife of Enugu State governor, they have already kicked off testing. And we are calling on them to use professionals, because one thing is doing the test, another thing is doing it the right way, so that in the end we will not have a complicated situation in our hands where we will not be able to manage information, because misdiagnosis is very, very dangerous. I have to use professionals in this testing scheme so that people could be tested and also get a valid result. And while they are testing, it's also good for the team to have vaccine handy, so that people who are ready to get vaccinated will get vaccinated, and people who test positive should not be abandoned. They should have to be enrolled for treatment and be followed up. The surveillance is very, very important.
Now, let's make this personal. For the everyday listener at home, at work, in the market, and on transit, what are the 3 top things every Nigerian should do today to protect themselves and their families from hepatitis? And if someone is afraid to get tested, or doesn't know where to get tested, or doesn't know where to start, what's your advice?
As a medical lab scientist, what I will tell people is the best thing you can do to yourself is for you to know your status, because early diagnosis saves life. If you don't know your hepatitis B or C status, go down to the nearest hospital. It's not quite expensive. Between 2,000 to 5,000 naira, you'll be able to run the test, depending on the facility. And if you run the test and you're negative, I have not taken the vaccine, please go and take your vaccine. And you have to practice hygiene. Don't share needle, don't share any sharp object, self-injection. Avoid self-medication, because that one can also lead to non-viral hepatitis. Self-medication is bad. Most of us are in the habit of consuming paracetamol on a daily basis. It's dangerous to the liver. If it's not prescribed, please don't take it, because it can damage your liver. Apart from this viral hepatitis, if you are the type that always consume alcohol, please reduce the intake so that you save your liver. Aside taking the vaccine, you also have to avoid all this so that your liver will be healthy. And by the grace of God, we shall all actualize the dream of the World Health Organization in collaboration with the World Hepatitis Alliance, that by year 2030, there will be no new transmission of hepatitis B or C. And in the end, we shall all be free at last from hepatitis viral infection.
And that's it for today's special World Hepatitis Day edition on the Breakfast Show on Radio Nigeria, Coast City 99 FM, Enugu. We hope we've helped break it down clearly, honestly, and usefully. Remember, hepatitis doesn't have to be deadly, but silent stigma and ignorance can be. So talk about it, get tested, get vaccinated, and remember to share this message. A huge thank you to our guest, Dr. Ejiofor Mamah, the first Vice Chairman, Association of Professional Bodies of Nigeria, APBN, Enugu State Chapter, and immediate past Chairman of the Association of Medical Laboratory Scientists of Nigeria, Enugu State Branch. Also, Assistant Director, Medical Laboratory Service, UNTH, Ituku, Ozalla.
Thank you so much for having me.
And to all of you for listening. Until next time, stay healthy, stay informed, stay involved. Producers has been Jude Obu and Anayo Egere. Supervisor is the General Manager, Coast City FM, Joy Obitilata. Executive Producer is the Zonal Director, FRCN, and with Dr. Ike Chukwueze. My name is Ekene Odigwe. Have a good morning.